heading to another prenatal appointment, and this is the week after my ultrasound, which was last week. It wasn't the gender reveal ultrasound, but like the usual, like the hospital that sees me every week. Oh my god, my face. She's going to read me the result of last week's ultrasound. So that was an anatomy scan and like explain the height, I don't know, basically everything about last week's ultrasound. And yeah, we're gonna go from there. Hopefully everything is okay. Just gonna put on my lip cheek tint because I was not able to at the house. I'm using this, I know you've probably seen this cheek tint a lot on my videos. This is from Burt's Bees. The shade is 1255 Lilac. Okay, so this is the look of the day. It's just pretty basic, so simple. I'm wearing a black dress because the color black is like your best friend when you have a bump, when you're like trying to dress up your bump. And then I'm wearing this thrifted, it's thrifted leather jacket with this details on the sleeve. It's so cute. I forgot how much I thrifted this one for, but I think it's just less than $20. So we're now home and Paula's having her nap, and while she's at it, I'm gonna finish folding the laundry, and then I'm just gonna go chat with you a little bit about how the ultrasound went and some of the major symptoms that I encountered during this pregnancy. So let me start with what happened earlier. I was not able to film while I was on the room with the doctor because he wasn't allowed. My obstetrician is a he, and he did mini ultrasound session with me earlier, even though I did the ultrasound last week, because he was like trying to show it to his student like how it's done, and I was also like was able to understand some of the terms they used to like explain the ultrasound process to each other. Basically, they were trying to measure the baby's head and like the 4 chambers of the brain, the heart, the lungs, the placenta. They're trying to identify if there are like issues with the placenta. I forget the term. Okay, so it's placental abruption, I think, if I'm not mistaken. Comment down below if you heard about that term. But like, that's like one of the issues with some pregnant women, if they have like abruptions with their placenta, that has to be given like intervention earlier, on the earlier part of their pregnancy. He said that the baby is in its posterior position, so it's perfect, and that's the ideal position of the baby that's already like ready for birth. So head down, because breech is the other way around, where the feet is like towards your uterus, I think. Yeah. Next thing that I wanted to talk about is that hemorrhoid situation. I needed an immediate attention because of my hemorrhoids. I used to have hemorrhoids before I was pregnant, but like it didn't swell like it did in the past week. So it was really bad that it swelled so bad. It was so painful, it was so uncomfortable, and the worst was that it was bleeding. I didn't have that specific symptom with Paula. I would definitely say that this pregnancy has like more challenges compared to when I was pregnant with Paula. I had really bad acne with Paula. Like I still have the scars on my forehead. It's an ointment with steroids, he said, that will help me ease the discomfort and will help the shrinkage of the blueberries in my anal area. I also asked the doctor if there's an option for them to drain the hemorrhoids. I also have a friend here in our city which also happened to have the same problem with me, hemorrhoids, that she's not pregnant, and she went through that procedure where they like poked or sliced something on the hemorrhoids, which is, she said it was so painful and the recovery time was around a week. The doctor, when I was there at the ER, advised me not to undergo such treatment, although that's an option after giving birth, but I did not advise that one, and they just told me to apply the ointment, the OTC medication that I just mentioned earlier, and that June 5th is my estimated due date. He said that the baby is too small for it to be delivered on the 5th. I'm actually not so worried hearing that, because I also heard the same thing with Paula. It's not that it wasn't concerning, it's a little bit concerning for me, but like knowing that we are Asians and Jofel and I are both petite, I probably was thinking that they do have different guidelines for weight. Probably the reason why they mentioned that the baby is smaller with my gestation date. I'm just gonna finish putting the laundry away. I still have another basket to go in the washer today. I'm still asleep. Hopefully I don't wake her up before I finish doing everything. Please leave some comments down below. I would really love to hear your thoughts and suggestions. This is Pauline. Thank you so much for watching, and I'll see you in my next one. Bye!